So today I'm going to be talking first of all, I just want to say thank you so much for this. This has been a real pleasure to work on, and we're really excited to present what we have. So what we're going to be talking about today is ginas. It's our plan for advancing the FDA's ingredient system. And I guess this is probably a clicker. Okay, great. So a lot of things that we consume as consumers contain ingredient lists. From candy, you can see over there, to drugs, to beauty products. And if you look through them, lots of them can be a little bit confusing. It can be a little bit complicated to know what you're actually talking about. So you can just see through here, you'll see things like microcrystalline cellulose, or inverted cane sugar, or carnauba wax, things like that. Now, it's very crucial for us to understand what those things are as consumers. Like if you have dietary restrictions, if you have allergies, if you have food sensitivities, this is absolutely critical. And it can be very frustratingly difficult to know exactly whether something is a problem or not. And that's where the FDA comes in. The FDA is very helpful in trying to be able to label those potential problems. But as hard as it is for us as consumers, the FDA's ingredient lists are much more complicated and much more diverse. So for them to be able to answer these questions well, they have to have some really good infrastructure. So for instance, let's say that we find out that red dye number 2 is toxic. So the FDA knows it's in more than just red M&Ms. It's more than just food. It also could be in cosmetics, it can be in drugs, it can be all over the place. And it doesn't matter where it is. If it's toxic, they need to know where it is. So right now, it's a complicated procedure to be able to answer these questions, like where is red dye number 2? There are many different databases that all use different names to refer to that same substance. And in different domains, that's just the way things work. So it's difficult for them to find exactly what they want and none of what they don't want, just based on name collisions. So there's got to be a better way, and the FDA actually has a better way now that they're working on. We're all familiar with the periodic table of elements, right? So using consistent scientific, objective terminology, we're able, not even terminology, just facts, we're able to know exactly where something goes. Irrespective of language, we know what the truth is. So the FDA wants to create a periodic table of ingredients using the same concept. There is objective truth about what something is that's consistent, and that you can, if you have something new, you know what it is and where to put it on a table. So this is what we've made. We call it ginas, which is the Global Ingredient Archival System, and it works like this. If an expert comes along with a new ingredient, they walk through a wizard, and it doesn't matter what the ingredient is, from a plant to a chemical to a protein, anything like that. They walk through a wizard, and they're able to put in all the detailed information they need to put in to completely capture what that thing is. As time goes on, there's a lot of convenience tools to make things a little bit easier, and there's a lot of validation tools to make sure that data gets in right the first time. While lots of things become somewhat complex, ginas never makes it complicated for people to do the right thing first time. And because of this, as soon as you get all this data in and it's all correct and it's all done at a low level, you can start to answer questions that you could never answer before. Like, what are the related forms of red dye number 2? What are things that are like red dye number 2? What are the products that have things that are like red dye number 2? So at the start of our HHS Ignite procedure 3 months ago, we actually were in an interesting place. We had a prototype ready to do what we wanted to do, what the FDA needed. And actually we had people at the FDA who definitely wanted to use it. But we had no good mechanism to be able to give to them. Sounds simple, but that was actually a very hard thing for us to do. So with the help of HHS Ignite, the increased visibility and our technical advisor helped us bridge that gap, and we were able to get a full working deployment at the FDA just 2 weeks ago. So what's the impact? So the first thing we noticed is that things are faster. It's faster for people to do daily work of answering certain questions and registering certain substances. So you can see some of that here. The other thing, the bigger impact is actually just in accuracy. Because of these walkthroughs, the data gets incorrect, and that means that you don't have to spend so much time and so much energy trying to track down all these little tiny errors. And this increases the FDA's ability to look at drug safety, drug shortages, counterfeiting, and really anything that deals with ingredients in the review process. So our goal at the end of the 3 months was just to have an FDA system deployed. But our development is open, it's open source, and we're willing to give it to anybody. And because of the increased visibility, we were actually able to deploy it in Health Canada and in 3 places in Europe as well. So now we're all starting from the same place. And we have interest all throughout the world in trying to adopt the same concept. So this is where we're going. Where we want to go next is we want to have deeper FDA integration. We want to be able to make sure that all these diverse areas of the FDA infrastructure are captured well. We also want to absolutely interface with the Open FDA initiative, which makes all this data available to the public very easily. Then we also really need broader adoption. So this is a system that is useful not just for the FDA, but really for anybody that has to deal with substances. We would hope that other HHS agencies are also willing to support us in this. We want this to be HHS-wide, really nationwide, and worldwide. And this is what we need. The main thing we need, by far, is just the support from HHS leadership. We just need people to put some weight behind this and say, we don't want to do things the wrong way, we want to do things right. Public visibility is the next thing that we really need. Just people need to be aware of it in order to know they should use it. And also, just to finish up some areas and to increase in certain convenience tools, we really need 2 additional developers.
And the major thing about this is that this is a freely distributable system with data in it. And basically, these systems are very expensive to develop. There's a lot of systems out there that handle chemicals, there's some that handle proteins, there's some that have nucleic acids, there's some that are taxonomic system. But there's not a single system that brings all this stuff together in one system. And so that's why it's very important. When we put estimates on the street to even develop a much lesser system than this, most of the estimates came back about $12 million. And, so I mean, it's going to save a lot of money. All the companies that are developing drugs will have the same system we have. Hopefully that will shift the work of defining these substances to the company and not to the FDA, so that we get the data in structured already. And we'll have a lot of relationships we already have in our system, where metabolites, impurities, things like that we don't currently have. I mean, and you'd be amazed that although we don't have a metabolite database at FDA, none of the other regulatory agencies around the world do either. And so this will improve, regulation and drug review throughout the world, we hope, and that's where we're really going with this.
Absolutely. So just to kind of sum all that up, we can make it faster, cheaper, and easier to review new drugs, identify safety concerns, and cooperate with the worldwide health community. Thank you.
So we've heard a lot of teams talk about how they interview 30, 40 people and kind of discover some